Right. Hi, I'm Tony. I'm the ex-dentist that has made this dental app. And so this is kind of a presentation on how it can work for all of us. And when I say all of us, it's the whole dental team and hopefully the public. So you're not going to see much of me after this, but a few shout outs. This is for my nurse. I could never have done what I did without being, as we'd say, four-handed. And yeah, so I worked with her for 20 years, and I set up this practice. I think it was 1995. I bought the semi-detached house, and then it's been an interesting journey. But I've always been interested in prevention, and this is what the app is all about. So fortunately, I didn't see too many of these just before I retired, but I think that's because generally I didn't see any new patients. Um, I just had the list that I'd seen for many years. But in the early days, I saw this, and as I say, I had a general anaesthetic when I was about 8, having a lot of teeth taken out in Liverpool, and I remember that distinctly. But not as much as I remember about 6 months after qualifying when I did a GA session in the practice, and I saw about 16 children, and that was horrific. I only ever did it once. I left the practice then. But it's always been the case that we should be promoting prevention, and there are many things that are wrong. We should have more fluoridation. And this is just a list of the reasons why I've made my app, is because I just got frustrated that I couldn't see anything that's ever going to happen in my practicing lifetime. But what did happen was we did start to develop computers, and everyone seems to have a mobile phone, so why not use them? So that's what I did. Initially I made a website for carers, because I know carers, this is about 6 years ago, weren't getting much help to look after their clients or patients. And my dad was in a dementia ward, and I think that was the impetus for starting. But I would say that if you want to get the references here, they're all on the slide. You can just pause it, rewind it, and if you want, knock the volume out. And that's how it should be. So I made this last night. I better knock out the volume, because actually this one is really for the reception area. And so this is when, just rewind it, and goes through it slowly and reads what it says. But with the latest techniques, you can use lots of different types of software in order to make the videos, but it takes a long time. So, and there aren't many good ones out there, I don't think, for what the patient wants. They don't really want to see pictures of people's teeth and tongues and saliva everywhere. So I made animations. And there's a good thing about having an app is you can personalize it, and it does the scoring for people, so we never have enough time. And so I was well aware of this, and so this was my idea, is to actually give people their scores, the BPE, that nobody knows what they are. It's like a secret. And other ways for people that we don't see, how they can check themselves. Because there's an awful lot of the public that are unaware of if they're doing a good job or not, and they just can't get to see us for one reason or another. So this was it, is my scoring chart, and you ought to have a go. The reason that everyone is able to actually put themselves on the app is because we all explain it. Patients often ask the reception and the nurses before they ask the dentist, because we're a little bit on the scary side, I suppose. But sure, you should be able to explain at least how to use the app. The vast majority of you will know exactly what we're talking about. But yeah, save a life, share teeth for life. It's all about oral cancer, which is a bit of a taboo we don't talk about. So there are about 40 videos within it. And so here's a couple. And in a moment you'll see it again. And I think it's got the volume on that I made, which is the front part of the video. So that's on the home page. When you first download it, you press info, and that's what we're talking about here. So hopefully you'll go back and play that again without me droning on. So this is the other one, and so I'm sure you can read. And yes, this is the one that's on it at the moment. And when I made the app, which is now really about 3 years ago, there was a different video which just used screenshots because I hadn't learned how to do the animations. So better put the volume on.
Dental app. This is an outline on how to use the dental app, whether for yourself or for your children. And you should be able to locate your dentist or hygienist via the postcode finder, but the app works well even if you don't see a dentist. You can personalise it yourself and for other members of the family. And it's, as with a lot of these apps, it's relatively straightforward to do that. You should be quite familiar with it. Once you've completed your profile, you can enter the scores given to you by the dentist or hygienist. And these scores have some explanations on what relevance they are for you. So while you might be familiar with your BP and your BMI, these are just a couple of dental references that you ought to take a keen interest in. Because along with these and the risk factors that you have yourself that you complete, there's a direct correlation to your general health and your oral health. Ideally, for any dental treatment to be successful, and even better, to avoid any dental treatment, you want to be in the green. And there's a monitoring system for those that don't actually see a dentist, and this is reasonably accurate as well. Obviously it doesn't replace seeing us, but there are video instructions showing you how to do this. And we can also highlight particular areas of concern that you can concentrate on with your cleaning, and actually direct you to specific videos showing you how to do this. There are lots of animations for all different age groups. There's also a section for if you have a dental emergency and struggling to get to see us. And one of the most important things to check up on is monthly for oral cancer. There is a limit to how much information we can give you, and there's certainly a limit to how much you listen to when you're desperate to get out of our dental surgery. But the idea of the app is just a go-to resource to help you look after yourself and help both of us have more rewarding outcomes.
Yep, so that was that's the one that's on the phone at the moment, but I may well change it. Do you prefer that one with the audio, or do you prefer one without audio and just listen to it? There's a divergence of what people want. But anyway, the way it should work is that nowadays everyone's familiar with a QR code. So to download the app, you can use a QR code, but otherwise you just type in Teeth for Life, whether it's on your app phone, your iPhone or your Android. And we should really have posters in the wall that you can customize yourself. I've made a supporting web page that you'll keep seeing references to. Surprisingly enough, it's called teethforlife.org.uk. And it has the details on how to download the QR code and how to make the card. So originally when I did the app pre-COVID, the idea was to give the patient a card showing what their teeth look like and the BPE with an explanation of it, and then some hot links, which are those numbers, which we would just put a circle round to advise the patient on which videos to watch. So they're the hot links. As you can see, there's lots of videos within the My Care section, and you just need to be able to show a patient how it works if they're not so sure, because I'm sure that's what will happen. So that's why I'm saying that everyone should learn how to use it, and really everyone can go on it. I see no reason why we don't all have a kind of a, hopefully what is a professional looking app that we can share. So, so talking about share, that's how you share it. So if it's when you've actually put the app or customized the app for yourself, then you'll be able to put in your links for whatever social media that you have. So if someone in the street corners you because they know that you're a hygienist or a receptionist or the nurse or even the dentist, then you can just share the app with them and be on your way. And the idea is for the patients that lots of times we don't see their partners, so we just need to have a good way to say, well, this isn't the same as seeing us, but it'll certainly help them keep their mouth a little bit healthier. The app doesn't replace seeing us, but it can certainly support us. So here it's got the list of of what the numbers mean. So 1 is, as you can see, toothbrushing. 2 is explaining the BPE and how to use interdental brushes. 3 is one about pocket cleaning, and that's why I made the app. Is I actually sent a patient, and it must be about 3.5 years ago now, I sent her an email of a video from Perio courses showing pocket cleaning, but this one's an animation rather than showing someone actually using an interdental brush down the gum. 4 is, they're all animations. The 4 is a bit of diet advice, and I've tried to explain what it all means rather than just tell people. I think a simple explanation may help encourage people to improve a bit. And 5 is habits, and that's really obviously I like them because it's spent so long making them. But the habit one is really good. So if you want to lose weight, you want to go to the gym, you want to get fit, you want to do anything, the habit loop works for anything. But I'm pretty sure it was developed by someone in advertising for dentistry. So there's an interesting fact. And the other part is that, yes, if you download it, it's free for DCPs and hygienists. But if you're a dentist, I've now started to charge, because otherwise, I can't afford to keep doing it. So there's a cost element to this, and we know that the governments aren't going to pay for it. So we've got to think of a different way that we can pay for it. And I'll try and charge the dentists first, and we'll see how that goes. So I used to give the patient, hand them a card with their name on it. So you're giving them a card with one side with their details on, and the other side you can put whatever you want on. So it's marketing, probably promoting the practice in general. And yeah, I can see I've got a spelling mistake there. I just can't spell to save my life. I didn't work in Sockwood, it was actually Stockwood. And yeah, but what I did learn was how to use templates. So if you don't know how to do it, then get your practice manager to do it. But that's what I used to do. I used to make templates for different things and just send them out with a YouTube link that I'd look up. But because I made my own app, I couldn't use the links. So there's only one video within the app, which is the one on oral cancer monitoring, and I got permission to use that. So like I say, it'd be useful if you had a look at the videos, and feedback. So feedback via the teethforlife.org.uk site, that would be useful, and then together we can improve it. So yeah, this would be a time to pause and have a little look, see what I've written. And this is another place to pause. So when I first made it, it was, I'll use this. This was the registration site, and it still is the registration site. And I made it, all the reasons that I made it are on there. And as I say, this is over 3 years ago now. But I was still working, and it was a bit, quite frankly, it's a bit of a slog. But I'm convinced it's a good idea for all of us. And so what I did is I put video links telling you how to do it there. So these links are here. I might be a little bit more old-fashioned now. And these are just links for the templates that you can see, so that if you click on here within the website, you'll come across the business cards, how to make your business cards. With regards to DIY, clearly I don't expect you all to make animations, and why should you? But some of you may be interested to do that. But someone in the practice is going to have to be able to upload things to the app in some way, or certainly make the templates so that you can send them to the patients. And if I can do it, then anyone can. You just don't need to be nervous about doing these things. The one thing generally I find with IT is if you make a mistake, you can go back. And this, I put this one in because I trained for 20 years. I really enjoyed the training. I had a lousy start to my career, and it was really great to be able to rather not teach my bad habits, but explain the good work that hopefully that I did, and also share some of the mistakes I've made along the way. And that's how we all learn. It's a bit difficult making mistakes in dentistry, so I hope I haven't made too many. certainly made lots of mistakes with IT. I think the computer's about to blow up now. Anyway, if you go onto the site that I keep saying, which, here it is there. This is the site I keep talking about. And this is a section within it called Pictures. So I guess I made this prior to having any real insight into how you make an app. I had my idea. I looked at apps that were around at the time, and I didn't like them because they didn't have a scoring mechanism for the patient. So the fancy word is gamification. But as you all know, you like a little bit of competition, even if the competition's with yourself. So just as I used to give my children badges if they were good, we can do something similar within this. But this is something I'd like to improve. Now, whatever app I make in the future, if my crowdfunding works, then it would still be the same in how it should work and how we're all involved. So step one is, prior to seeing the patient, you send out an email or an M&S, and it'll just say, have you downloaded the app, with a link to download the app, even if it's just the name. Step two is when you come into the reception area, then you'd have your QR code on the wall, and hopefully you'll have a reception with a screen, and you're not going to show videos of all the teeth, but that first video I showed you will direct people to sort of take ownership of their health, which is what the app is about. It's too many people tend to think they come to see us and lay back and think we fix the mess that they've made. We need to instruct them to know how to look after themselves. And as you know, if they're not looking after themselves, they need treatment. But if we don't get rid of the cause, then the treatment fails. So if people actually stay in the green, which is how the app works and scores, then they should need less treatment, and we can guarantee our treatment for longer. I think on the health service, it's still you guarantee you work for a year, which quite frankly is terrible. I'd be embarrassed if things didn't work for a year. Anyway, step 3 is the most important, and that's where there's that physical meeting with the dentist and the hygienist and the nurse within the surgery, and you give them the card. I've asked my patients prior to leaving about the BPE, and I wasn't great, so I'd say maybe a third at most knew roughly what I was doing, which is slightly more than the ones that when I asked them to stick the tongue out. Nobody, I think, less knew that you were looking for oral cancer. So that's the thing, you give them the card, but it's very important that you send an email. So the email template, generally the assistant or nurse would send it out, and you ask the patient while they're in the surgery, did you get the message? Because often they go to junk. And if they've got that, then we've got a record of giving them their oral hygiene advice. So that'll help prevent against some litigation, I would hope. And then step 4, again, that's an automated process. So again, before they leave the surgery, if it's set up correctly, you can say to them, should I send you a reminder? And I thought maybe you'd send a reminder in a month's time, but some people think you should just send it in a few hours' time when they've got home. It is the case that it's always been the case that people are less likely to take what you say on board when they're in the surgery. It's often better in a more relaxed environment. So the most relaxed environment is probably when they're at home. So yeah, I'm pretty sure when I press the button now, this is going to show how you can register yourself via a phone. So let's do that. Okay, well, let's try again, because the audio that was with this is really poor, but this is how you go on. You go via the careforteeth.co.uk website, and it brings you up to here. And then most of you will be familiar with this if you've been on Facebook or Instagram. I think it kind of follows it. But you just put in your details as it asks for. Now, I'm not great at typing, as you can see, but you just go along, and yeah, you have to remember to put the country in, because I've now got the original postcode reminder is now a global reminder. So whilst it's asking for our zip code, it actually picks it up from the town or city that you live in. So it's important you put what role you have. If you're a dentist now, it'll come up asking for a charge. But as a nurse, hygienist, or therapist, it's free. And the idea is just so that you'll share it. So use it and share it. So let's see where we go now. Right, it's going to go into the bio. So have something prepared or just type it in. You can take a photo of yourself. So I'm sure you've taken a selfie. So that works. I wasn't going to do a selfie because I've done too many. So there we are. There's Teddy. There's my Teddy. So Teddy now is a hygienist, and yeah, so you carry on with your bio. So I didn't type much. Oh, you put your qualifications in. And like I say, it should be relatively straightforward. Yeah, I think it'll take about 10 minutes. The next section will show rather that it's be fixed for you, and it isn't fixed for the dentist. Yeah, there we are. There's my slow typing, and I'm a great fan of Paddington. And yeah, so if you have your own Instagram that you want people to look at, or your Facebook page, and it might well be that you do something else, like maybe you teach Pilates and you got an Instagram page for that, then you'd stick this down, and then it'll work. So yeah, watch those little, when you press submit, those buttons should go. If they don't go, it means it's not working. But generally it works fine. So these are the areas of expertise. So skip through them, but the three are fixed. So there may already be a practice up there, so you need to delete that and add your own practice. Now you should be, if the practice is there already, it'll pop up. So there's a lot of them. So I'm Teeth for Life. So I'm looking for that, I guess. But if it's not up there, and add a new one, you just got to, I'm going to change this hopefully so it's alphabetical, because you can't go through all of them. But we don't want any duplicates, because that would make it difficult. And then these are sections you put in for the practice. So as a practice, you put in the link for the prices. If you've got online booking, you can put that in. For some reason, you need to put in where the country again, and you can see I forgot to do that. And yeah, when you actually fill in the details for when the opening hours, put the opening hours for the whole practice. Don't put them just your hours, because when someone else uses it, that'll make it a little bit more tricky. And clearly that's something that we would do different in a future version. So this is what it will look like then when someone tries to find you. You should be typing the city that you're at. You can play around with the scroll bar, as you can see there, because it goes up to 20 miles. And there we go, past me, and there's Teddy. There's a lot of me. Okay, and the services. Oh, so these are the services. As I said, they're fixed. So there's health, whitening. So I missed the other one. And there's what it will look like. All right, well, like I was saying, these are the three fixed roles that you would have as a DCP. You probably want to keep them on still as a dentist. But by the time most dentists see this, I'll have probably about 15 different services, and then you just delete the ones that you don't do. So if you're not big on adult ortho, there's lots of reasons for not doing adult ortho and implants, but you do a few fillings. I haven't actually done one on extractions, so I need to do that. But you just delete them. As you could, when you go into services, you just go into delete. So that's the slight difference, well, apart from paying, of course. Right, oh yes, and this is showing the dentist. So these are the ones, if you went to Bristol and look for Teeth for Life, these are some of the ones that I've put in. And yeah, so this was whitening. That was my brother. I only did the top. He didn't pay at all. I did give him some whitening for the bottom in the end. You can only ever do that kind of thing with family. And I like my CEREC, and I never did adult ortho. I did an ortho course for a year and then decided it was too risky. But that was 25 years ago, so obviously it's a lot easier now. So pause and have a little look at what I've written down. I'm sure you can do better. Yeah, and so these are in my profile. Uh, I think this might be, yeah, I think this might be me talking again. All right, let's see if it sounds good. I'm just going to go quiet.
So this is just to give you a bit of help on how you can make your own profile. So instead of profile help, it may change over the next few months, but basically this is how it is. You can create your account. Most of you may have an account and forgotten it. So just use the forgot password that we're all familiar with, and you should be able to access your profile. So in this section, it's as it says, these are basically bits that I put onto my own profile, and I'll show you how to do it. So if you want, you can use the text, but I advise you to make up your own. But the video links are there, as you can see, Vimeo, and they're the pictures that I had. So you go onto your profile, go for expertise, and if you don't like what's already up there as a default, just delete them. And then you add your own. So I'll try and talk through this. Add a description, of course. You'll see my typing is extremely slow, probably make a spelling mistake. Not quite good there. So we all know how to cut and paste, I hope, and this is basically what I do. So while I say you do your own text, you can always copy mine, but I'm sure you can do better, and probably typing yourself will be quicker. So then, to add the video, there's a section within the expertise, which you'll see, or have seen. So again, with the video, I cut and copy, but it'd be useful if you've found some better videos and let me know what they are. And then it's adding an image that will sit for the video as well as before and after. So the images on this page I would have cut and copied. As you can see, I think you'll probably see me dragging it over now to my desktop. And then you do the same. And then what you'll do for your profile is just bring them back and drag them, or rather upload them in the expertise, as you'll see here now. So you just go in, choose the file, and there are the pictures there. So I'm sure a lot of you are familiar with this. I think potentially is a problem if the file's a little bit too big, but then in preview I just make them a little bit smaller. So again, I'm just showing you can do all that. And you'll see now I start to panic, because what you should do is press the submit button, but nothing happens. Well, this is because this is in the hygienist or the DCP section, and you can only have the 3 fixed services on it currently. As dentists have more to gain by advertising their procedures, and that's why I've decided to charge dentists. So there, I've gone onto one of my little profiles, and I'll show you what happens if you're registered as a dentist. So I'm just doing the same thing, going through it, showing you cutting and pasting, which I've got to be quite reasonable at. And on this one, you'll just notice that when I actually upload the picture, it doesn't come up straight away, and that sometimes happens. Like with all these things, it can be a little bit glitchy, but it generally works fine. So you add the videos, or rather the images that go with your video, and then your before and after. If you've got your own, use them, they're probably better. And after we've done that, it's you just press the submit button. And this time when you see, when I press the submit button, it actually comes up and you can see it trying to do something. And again, generally this works fine, but sometimes you have to do a couple of attempts. I'm not 100% sure why. It might be internet connection, but now you can see I've got 2 sections for root fillings. And really, I think having 1 root filling is enough. So you can edit whatever you've written before, or you can change the images, what you've done before. And then you just see here, I'll delete. And then it just scrolls down, so the next section is on your practice. And so I'll probably make another video for that. So I hope this was useful.
You can search through the find your dentist or hygienist section, and you can narrow down your search. So obviously, if you're in a city, you'll have quite a few more. If you're in the country, you may have to widen the bar a little bit further. Right, and it says, basically what else we're going to do with the app, but just see if you can find yourself once you've registered, and that's how it'll go on. Now, again, I've made another video, so we'll see if this plays, and it's about how you register the practice. Clearly the section before about how you change how you alter your profile, it only really applies that if you're paying for it. But all these principles are very similar. This is how to add a practice or amend a practice. So we'll go with Teddy, and yeah, if you've forgotten the password, that does work as we said before. Hopefully this will bring me in. Fantastic. So we've done the bio, we've done the expertise. Well, there isn't much for Teddy. He's not really a dentist. But so for the practice, I've put him where, at my virtual practice, which is Teeth for Life. So we're going to remove that. So we just delete it. And then we add a new practice. So this is on a PC. And so that what you want to do is to check that your practice isn't there already. Now, clearly, there are lots of these, but we need to add Bupa wherever they are, like there's one here. And it needs to be alphabetical, so I'll look into that. There's an interesting one. That's where I used to have, where Santa was for one time. Anyway, yours won't be on there, so we're going to add a new one. So add new, and so we'll give it a name. We'll call it Ted's Practice. Right, and then obviously just add an address. So and then we can say that's in Preston. So you'll just go through it. So this is important, although the name, the name is far more important now. So when people look for it, they'll look for it in the by typing in the name of the town rather than the postcode as it says in some other areas. So yeah, we'll just say that's the thing. And then, yeah, we had this before. So as I said before, this is worldwide now. So we'll just say for argument's sake, it's Albania. Then you add in obviously the practice numbers. If you've got a second one, you put that in. And then this was, it'd normally be, the one for the practice itself rather than the individual one for sure. So we'll say that's that. And then again, if you've got a Twitter one, just add that handle for the practice. And anything else. So if you've got practice one, or now this is interesting. So you go to the website, and then you'll just drag and drop that. So for argument's sake, we'll say it's. Clearly it's not, but I'm just trying to demonstrate it quick. And I can't type. But then we'd have the link to the website. I mean, obviously you want that because you may well have, for instance, you may have online booking, which I never really liked, and I'm struggling here to type at the same time as talk. But I'm a male, so that's not really possible. So yeah, we struggle with that. Anyway, so we'll just say for argument's sake, it goes from 8 till 9, right? So I'll just do that. And you can put a little bit more, as I said before, I'm not the quickest at typing, so I'll just copy, which is the Controls P, and paste. And then you just put that in. Then it's not available. And really that's it. So you just press submit. Yeah, and there we are. So somewhere it'll be, well, clearly you won't be going there, but that's how it is. Yeah, so, if you go move somewhere else, then, oh, there we go, that's just around the corner, and then you just add that one, and then you would press submit. Oh, well, these people haven't put the country on it, so better get down. There we are, so it's there now. That practice is on here. So yeah, so Ted will appear there as well, or you will if you work at 2 practices. Right, I hope you found that useful. It will be amended in that 1, want to get the practices alphabetical, and 2, we have to be careful that you don't do duplicates. So
because that could be confusing. And if you have a duplicate entry, then obviously get in touch with me, but the best thing would be not to have one at all. So again, I hope you found this useful.